Magellan for a little less than a year. It went super fast. And I've been having a great time getting to meet you, getting to know you guys through just consultation meetings, shaping reviews, peer-to-peers, just outreaches, and I've really appreciated the opportunity to do that. And in my almost year, what I've noticed is that you guys are all doing amazing, great work. And what I've also noticed is there tends to be patterns in terms of the interventions and specific interventions and strategies that providers use. And I get it. I was a provider for many, many years. You kind of find your bag of tricks, and that's something that you're comfortable with, and that you use consistently, and that can be great. But I just wanted this training to be an opportunity for us to explore and be reminded about the other options and strategies that are equally as effective within CBT and BT for IBHS. And also to talk about the language and the wording that you guys use when you are with your clients, regardless of how, what age they are. The work that you do with them is important and it's life-changing, but it's not magic. And how do you translate what looks like magic into everyday language that they can understand and parents can understand? Because ultimately, the goal of IBHS is to go in, assess, develop strategies and interventions that are effective, train the key people in a child's life, and then transition out, because what you're doing is you are sharing the skills, you as experts, and you're making parents especially, as well as other caregivers and school staff, the experts, so that when you transition out, the work can still continue. So that being said, let's kind of dive into the learning objectives for today. JC? And please ask questions along the way. You don't have to wait till the end. So I'm hoping that by the end, you will be able to name 3 techniques that reflect CBT within IBHS, but something new, something that you're not using or that you don't use frequently. Again, 3 techniques using behavioral therapy. Again, maybe taking away something new or a reminder of the effectiveness of something else, as well as really talking about the role of parent training in IBHS and the goal of making parents the experts so that they can continue the collaboration and skills transfer training with all of the individuals that come into their child's lives. Next. So this is me. You guys know me. But I also want to, again, open up the opportunity to let you know that I'm available to you at any time. If you have questions about a case, you just want to brainstorm. You also, if you want a deeper understanding of what my thought process and approach is for shaping reviews and peer-to-peer, or if you just want to, outreach to me on any thoughts for resources or things like that, you have your care managers who are experts, but if you just wanted to touch base with me, I am more than happy to meet with you, and I've met with a lot of you over the years, so that's been great. I'm going to put my email in the chat so that you have it in case that you need to outreach to me, so it's there. Chasey. All right, so we're going to be talking about 2 psychotherapy focuses today. We're going to start with CBT. Just for reminder and purposes of my due diligence, I have to give credit where credit is due. So cognitive behavioral therapy, as you all know, integrates theories of cognition and learning with treatment techniques. It assumes that cognitive, behavioral, and emotional factors are interrelated, so that they influence each other. So essentially what that means is if you're changing one aspect, the others will follow suit over time. It focuses on the thoughts and the emotions and how they impact the behavior. But also keep in mind that altering the behavior, which you guys also do, impacts the altering of thoughts and emotions. And the goal is to really change a client's maladaptive thought process, shift their emotions and problem behaviors through restructuring and techniques to achieve long-standing change. It's been around since the 60s. Thank you, Aaron Beck, for this amazing treatment. It is actually the most empirically validated and researched treatment among children, adolescents, adults, couples, families, anybody. Extensive treatment that is effective for a wide range of psychiatric issues, depression, anxiety, eating disorders, substance abuse, personality disorders, and behavioral disorders. So this really captures, again, a lot of what our kids struggle with. It's structured, it's didactic and educational, collaborative, and goal-oriented. So you're teaching the skills not only to the client, but you're also transferring the expertise to the parents through the educational component and the structure of it. JC? So what are some of the common CBT techniques? So I just listed kind of really the heavy hitters here, but I want to talk about what is it that you guys do as well. So in terms of relaxation exercises, um, what are the physical aspects that you work with your kids on in terms of how to impact and shift their behavior? So from you, considering you're the experts, you're there, you're, boots on the ground, what are the relaxation exercises that you are using with your kids? Is there a difference between the exercises that you use, the relaxation exercises between the little guys and the older kids? What are some thoughts on that? What are your experiences? I know you guys use relaxation techniques because I read about them all the time.
Yes, okay, I'll go. Hi, my name is Olga Stepanova. I am BCABA at CLIU 21. First of all, thank you for this training, and it's such a refresher because everywhere for the past few years, I'm sure everybody we do ABA, and we forget that most of the things that ABA has CBT also includes, and you brought up relaxation exercise. We do them now. I would use saying like sensory breaks or de-escalation techniques. And actually, what I found that with the younger kids, it's more focused, including like the other senses rather than breathing. Like we'll do, like count and they're touching their hands, let's say, or candle. With the older kids, they do more focus on breathing and more of uh, I don't want to use the word meditation, but more of a calming, like think of a safer place that you can go. Will include like their imagination and a feedback on what makes them, what place they want to think about to kind of de-escalate. I would say that's what I do, and of course it depends on situation. If it's just like pre-antecedent technique, or is it more like after we had a crisis and we need to calm down? So
Thank
it's
you,
just kind
Olga.
of briefly. You're welcome. Thank you.
I'm also seeing, again, deep breathing, tapping, laughter. That's great. How do you get the kids to laugh though? Like, are you just initiating the behavior and then you're encouraging for the release of um, the dopamine? I'm wondering how the laugh gets triggered. That's curious for me. Um, and then the 5, 4, 3, 2, 1, the grounding technique. We have progressive muscle relaxation, guided imagery. And when you guys are using these, are you using more than just, and this is just something to think about, are you using more than just your voice? Like, are there visuals attached to what it is that you're using? Is there tactile, as Olga said, trying to tap into the senses? So it's going to be very important as you're using any of the techniques to try and tap into as many of the five senses as possible so that you really are triggering various aspects of learning for a kid. They may be able, they may be more of a visual kid, they may be more of an auditory kid, they may be more of a tactile kid. But if you're engaging as many of the five senses with using these techniques, it can be very helpful. Again, we're talking about a second one is stress reducing techniques. So you've mentioned some of those: visualization, guided imagery, progressive relaxation, music, visuals, again, laughter, roller coaster fingers for, younger kids, imagining a happy place. And when you're talking, again, when you're asking them to visualize their happy place, are you asking them also to reinforce it by drawing a picture of it or getting a picture of it, or talk to you about what that picture looks like? Or are you asking them just to be in a quiet place and picture it for themselves, which for little kids can be a little harder versus, can you get me a picture of a happy place or a calm place? Or can you draw a picture for me of what that place looks like? These are all wonderful. Thank you for sharing. In terms of another common CBT technique, and also that I see when I'm having my meetings with you guys, is role play. And what does role play look like? Are you using role play based on suggestions that are coming from the child? Are you using role play because of the challenging issues that come up from school or from parent? Like, where are you getting the sources of the role play ideas? So in terms of role play, I think it's really important that it, along with all the techniques, that it be as child focused and centered as possible. Um, how does the child see the challenges that they're experiencing, and be able to shift that into a role play scenario? It helps with better buy-in. It helps with the child being able to understand more of their role. And when you're role playing, what parts is the child playing? Is the child have the opportunity to play themselves as well as the other person and an observer? How does role playing work for you? So we have role play a situation, child struggling with, they take the role of the parent, they teach, okay, so they're taking everybody's role. That's wonderful. Role reversals, acting out positive ways of dealing with the frustration. Again, child is playing the various roles for different perspectives. That's wonderful. And you're walking them through it. So you're kind of modeling it for them first, it sounds like, and then you're role playing it. Is this a different experience for the little kids as opposed to the older ones in your work? What are your thoughts on that? Okay. Vincent said yes. Again, you're welcome to come off mute and share as opposed to texting. And you also use social stories and pretend play. Wonderful. In terms of modeling, again, CBT technique for modeling, being able to, again, ask, starting from the child, regardless of what age, they generally have an idea of what the challenges and the issues and the struggles they are having are. And they can express that through words, or sometimes definitely their behavior, but also in other ways, um, by maybe comparing it to a show that they've experienced or a character. And then asking them, is there somebody in your life, or is there somebody on TV that that you think has behavior that's helpful or behavior that's safe? To be able to tie it to something that they're familiar with. So we have little kids role play using Superflex characters. And what would Superflex do? Absolutely, trying to put them in another um, perspective. Absolutely, that's great. In terms of restructuring and cognitive restructuring, we're going to talk about that more in depth. But before we go to the next slide to talk about restructuring, how do you use restructuring with the kids that you work with? How do you use cognitive restructuring? Okay. Well, the next slide will have some thoughts on that, at least my thoughts. Hopefully they will be helpful. Not yet. Chasey, can you go back a little second? Wasn't there yet. Um, So retelling the story from different perspectives, that is a good way to engage restructuring, especially it's very concrete. It does initiate and kind of compel a child to take other perspectives, kind of bring more abstract thinking, prepare them for that pattern, even though they may not be quite ready for that developmentally, but being able to set that pattern up for them. Seeking out evidence to reframe automatic thoughts, absolutely. For so Socratic questioning, so looking for the data. What's the data that people, don't like you? What's the data that people think you're stupid? What's the evidence for that? Absolutely, that's wonderful. Self-compassion as a CBT technique. How do you guys use and support the technique of self-compassion with your kids? This is one that I use a lot, and I've used it a lot in my career, regardless of the age of the person that I am working with. Self-compassion. How do you guys use that with your kids? So self-compassion is related to self-perception and your feelings about who you are and what you're about. So positive self-talk can have a real positive, lack of redundancy, impact on an individual. So what are the messages that kids are saying to themselves, either out loud or in their head? And what compassion phrases through self-talk or mantras or positive statements can you work with them on to again start refuting the negative? Because with our kids, as we know, a lot of times because they're targeted by others, they're called out for their behavior a lot. Their behavior causes people to be unhappy, whether it's parents or caregivers or school, and it has a negative impact, and we know that. So, how do we start supporting our kids with being able to understand how can they use empathy on themselves? How can they change their perspectives on how they're feeling with self-talk, and it's about being kind to yourself. How do you work with your kids to be kind? So you have positive mantras, mantra of it's okay to be yourself, positive affirmations. These are wonderful. And then I'm strong, I'm brave, I'm smart. It's a great mantra. Working on self-esteem by telling them that they're worthy. Everyone makes mistakes. Helping to develop that mantra. That's great. And again, we're looking to tap in the five senses. So what are the strategies you're using to make sure that, or to reinforce the use of these self-compassion strategies on a regular basis? So they're hearing it. So again, talking to the parents about and the teachers about use of these to self-statements so they can reinforce them, the kid can hear them, the kid to teach the child to use the phrase themselves. If they're able to draw a picture that triggers the phrase for them, or they can write it down for themselves. And is there some kind of tactile or comforting object that they can associate with that positive statement, or that statement of compassion? Again, you're trying to connect the techniques to as many of the five senses as possible to provide the most reinforcement for a child, and to be able to respect all of their ways of learning and all of the different types of intelligence that are out there and that our kids have. And again, problem solving skills. So in terms of problem solving skills, I know some of you are using specific curriculums for problem solving skills, which I think is great. Some of you are using that for more of an expertise approach, not necessarily a curriculum. And is it different for you in terms of your decision to use a curriculum versus not a curriculum when you're talking about younger or older children when you're using problem-solving skills? Oh, Vincent has created songs that he can sing. I would love to have a singing session with you, Vincent. I think that would be great. So what about problem-solving skills? I want to take you up on that, Vincent. Um, problem-solving skills, again, curriculums that you're using if you're, open to sharing the curriculum, but also how do you connect the problem solving skills to as many of the five senses as possible. So that's going to be something I'm going to repeat throughout this entire training, because you get the biggest bang for your buck, if no matter what age you're working with, when you can connect a technique and a strategy to as many of the senses as possible. It taps into various learning styles, and it taps into the various intelligences that people have. What other CBT techniques are people using that I haven't listed? But like I said, I just listed the most popular heavy hitter ones. You have the whimsical flow charts, rhyming phrases with the steps to problem solving. That's wonderful, Sarah. What other CBT techniques do people use? For older kids, I have had success with exploring the concept of core beliefs with them, and helping them to identify what their core beliefs are in terms of themselves, the world, and others, and how they use the core belief as a filter for their thoughts. And because core beliefs are maladaptive, they tend to be negative, how that grays a picture of a situation. So being able to, with older kids, um, really identify core beliefs. And there's a few kind of major ones. You don't have to go through all of them, but which ones generally your kids likely tap into. So what I like to do is maybe offer like 5 or 6 after I get to know a kid, especially with this is an older kid who has, started the abstract thinking process, or I can start to guide them along that way. Um, Being able to work with them identifying core beliefs. Active listening, that is very useful, very helpful. Understanding the 5 levels of human needs, Maslow's hierarchy. We have self-monitoring, logs, diaries, journaling. These are all wonderful. Thank you for sharing. Chasey, now we're ready for the next one. All right. So as I had said, CBT tends to be the gold standard. It is the most researched therapeutic approach in treatment, and it is the gold standard with kids who have anxiety. Keep in mind that when there is an anxiety diagnosis with your kids, to keep in mind that CBT is a really effective option. A lot of times I'm seeing really just behavioral techniques, and especially if you're working with the older ones, they have the cognitive capacity, the ability to start abstract thinking, putting pieces together. So I really work to try and take advantage of that. The effectiveness of CBT is supported in research for your anxiety disorders, your OCDs, your PTSD, and your depression. And also the outcomes and the improvements last after you're gone. So research really shows that the effects last longer than when the person is in treatment, which is really the hope and the goal of IBHS. which is one of the reasons it's so essential that you guys are transferring the expertise to the parents. The parents are the center point for the child after you guys leave to continue to teach the teachers, the coaches, the other adults in a child's life, what are the techniques that are helpful for the child. This also reduces the tendency for having to teach or wanting to teach school staff over at the beginning of every school year. It's hard for you guys to do. I know there are wait lists. I remember the wait lists well of kids who want to get into your service. Being able to transition out, being able to teach the parents and helping them become the experts is the key to being able to do that. Also, in terms of research that was done on CBT or is done on CBT is done in a university setting, which is always a perfect setting. There's never any interruptions or problems when you're doing research in a university setting, but happily, research that's conducted on CBT outside of a university setting is found to be just as effective as when research is done in what might be perceived as the perfect setup, which is a university setting. So that's really good to know. So that really is one of the greatest bangs for your buck in terms of working with kids. Chasey? So let's talk about externalizing behaviors. So we talked about internalizing behaviors. Again, just quickly, research is also equally effective with externalizing behaviors, which is a good chunk of the kids that you get, which is your ADHD, your ODD, your conduct disorder. And keep in mind that externalizing behaviors over time are really what really happens if they're not treated is the underlying anxiety and depression. And CBT is very effective at targeting anxiety and depression. So being able to provide that approach to the kids can reduce the inclination for later severe impairment with underlying anxiety and depression when you have an externalizing behavior. It's very easy to go with the externalizing behavior and focusing on the ADHD and the ODD and the CD because it's there, it's loud, it's causing problems, causing suspensions, causing fights. But to really look at what is the might there be anxiety or depression that's really underneath that, and being able to tackle that is helpful. So again, the last training that I did made some suggestions on some assessments for kids, especially for anxiety and depression. So to include that in your repertoire can be very helpful. And again, when you're looking at externalizing disorders, research shows that CBT is just as effective whether it's in the community-based setting as it is in the research-based setting. It has also been found to improve social competence and reduced parental stress, which tends to be highest for externalizing disorders. So that's really, another reinforcer and a reminder about the effectiveness of CBT. Chasey? So let's talk about some of the maladaptive thought patterns that happen with CBT. Yes, Marshall, right? I'm sorry if I didn't say your name correctly. If you reach out to Chasey, she can connect you to that prior training I did about assessments. So to go back to CBT and your thought patterns. So these are some of the major ones. You're looking at all or nothing thinking, black and white thinking. So things like everything is good or bad. If I don't do something perfectly, I failed. So this, black and white thinking developmentally is what you would expect of young children. As kids get older, they have the capacity to expand their thought process so that it's more in the gray. And that doesn't officially formally happen until your early 20s when the frontal lobe is fully developed. However, what we can do for our kids is we can start the process for them and to teach the parents of what are the techniques to challenge the all or nothing black and white thinking. What are the questions? What are the strategies? And what happens is that, as you all know, learning tends to start from the outside in, which is why reinforcement is so effective, repetition is so effective. Learning starts from the outside in. So over time, as a child is also naturally maturing and developing cognitively, when the repeated patterns of impactful um, behavior or strategies are maintained, they start to learn to do it for themselves. Overgeneralization is another dysfunction or maladaptive thought pattern that we see with our kids. So seeing a single event as part of a pattern, that something always happens because it's happened a couple times. Mind reading, so thinking you know what somebody is thinking about you or something that you've done, and it's automatically bad. So think about your kids in terms of, I can think about the kids that I've worked with, and I can identify exactly who's the kid who does the all or nothing thinking, who's my overgeneralizer, who's my mind reader, and being able to target interventions for that particular cognitive or thought pattern dysfunction. You have your fortune tellers who are like, well, it's not worth doing or learning because it's never going to get any better. Everything turns out badly for me. Nothing ever goes right. So it's not worth it. So the kid gets defeated before they get started. Your magnifiers and your minimizers. So you're exaggerating the significance of a minor problem while trivializing their accomplishments, but also minimizing their impact and their participation in something that may have been major. In your should statements, focusing on things that you should do, which can lead to severe criticism as well as feelings of resentment towards others. I mean, these patterns, we do these as adults. So in terms of helping to identify what they are for the kids, again, working with parents to understand what are these patterns of thinking, how can parents catch these patterns of thinking, and then what can parents do to support the shifting to a more adaptive approach. JC? Again, a couple more. You have your comparative thinking, which is measuring yourself against others, feeling inferior, even though comparison isn't realistic. Some of those thought patterns are within the realm of what might be normal development, especially when you're looking at adolescence. And adolescents, the scope of their mirror of the self is peers, and that's appropriate. However, there is a fine line between the appropriateness of some of these thought patterns and when it can kind of go over the cliff and become harmful and hurtful and damaging to a child. And then your probability overestimation. So the belief that chances again are something is going to happen is higher than it actually is. And emotional reasoning, the thinking pattern of, I feel like it's true, therefore it is true. Think about how many kids are like, well, it feels like they hate me, so they hate me. And again, what type of strategy are you using for that? What kind of are you using Socratic questioning to ask them what is the real evidence? Feeling is not an evidence. It's not a fact. So what are some other dysfunctional patterns of thought that you've heard of? Fortune telling with an adolescent. You often see thought patterns with trauma. Absolutely. Looking to manifest positive results, thought challenging versus reality, and working with parents on how their behavior affects the child, how to change their own behavior. Absolutely. Again, part of the parent training that you're working with and you're working towards is helping the parent to understand how their patterns are maybe helping or hurting the situation with their child. Another one is catastrophizing. So exaggerating the severity of the situation. This is the worst thing that I've ever done. I forgot my hockey helmet. It is the worst thing I've ever done. I'm the worst kid in the world. Nobody likes me. I should just quit hockey. It just kind of starts to go off the cliff. Chasey? All right, so I'm also trying to be mindful of time. So behavior therapy, again, going to go through, give its due diligence. It's a form of psychotherapy that applies principles of learning, operant conditioning, and classical conditioning to stop symptoms and change ineffective or maladaptive patterns of behavior. So this really is very much your pragmatic ABC. It really doesn't have anything to do with thinking. It doesn't really have anything to do with your feelings. It is purely about behavior. However, it is not a one size fits all, and there are various techniques. Olga had said, ABA. We've done CBT, DBT, exposure therapy. There's rational emotive behavior therapy. There's social learning theory. There's a whole bunch of behavior therapy is a very broad umbrella, and then you have the different categories that are underneath it. So other than CBT and ABA, I've listed a couple of others. What are the other theories that you guys are incorporating into your work? People using exposure therapy? How are people using DBT? How are people using social learning theory, motivational interviewing? Here and now Gestalt, that's great. Anything else?
With my very little ones, I use often play therapy.
Very good, very good. All right, Chasey? So for your behavior therapy techniques, again, I just hit the highlights. You have positive reinforcement. So you're rewarding desired behavior to increase your frequency, involving praise, your token economy, your rewards, your premac, your privileges. We're looking again at modeling, demonstrating the desired behavior, asking the child and the parent to imitate it, as well as school staff. Systematic desensitization. So again, gradually exposing a child to anxiety provoking situations or stimulus while using relaxation techniques. You got your contingency management, which you guys use a lot. You do a great job with that. Establishing clear rules and consequences for behavior, rewarding positive behavior, planned ignoring, redirecting. You guys do that very well in terms of using those skills and transferring them, as well as role play. Chasey? Again, I mentioned token economy, exposure therapy, aversion, therapy, journaling, visuals. A lot of you use visuals, again, for schedules and checklists. I'm going to just reinforce what I've been saying. All the techniques and strategies that you guys are using and that are effective, try and tie them into as many of the 5 senses as possible. So a visual is great, but is there a way to turn a visual into something auditory, into something tactile, is into something olfactory? Like I would put smelly, like nice smelling stickers on my visual charts with my little guys, and they would want to scratch it so that they could smell their visual checklist or reminder. And it was a way for them to remember, oh, I'm getting angry, I'm getting upset. I'm going to go to the chart. I'm going to see what it is that I need to do, and I'm going to smell it. Was very helpful for them. And also for mindfulness. Again, looking at these different techniques, what is appropriate for your little guys versus your older kids. Chasey? And then you're looking at impulse control techniques, your stop, think, and act. There's various curriculum for that. You guys have specific strategies that are formal or informal, and also breaking down larger tasks because tasks, in their totality can be paralyzing for a lot of people, not just kids. So how do you work with parents to break down a task? How do you work with a kid to break down the task into little pieces? Are there other behavioral techniques that you guys are using? We have scented stickers, scented erasers, and Play-Doh, use of EMDR. What else are people using for behavioral techniques? Negative thought interruption. Good. All right, Chasey, we don't have too much time left, and I have the parental component to get through. All right, so parent involvement. So parent involvement is a huge part of IBHS, as you all know. Working with parents on helping to learn alternative ways to identify and understand their child's behavioral challenges. You're working on positive parenting practices. You're using as many techniques with parents as well. And when you're working with the parents, are you providing them with the education in terms of what is the name of the technique that you're using, as opposed to, well, we're just going to practice you being in your child's shoes, or you being, you know, uh, the coach. Do you identify the strategy that you're using with its name so that the parent has an idea that what that is it's called role play, so that they're able to use that same language with their child versus an abstract concept of let's pretend I'm me and you're you. Being able to give parents the correct language is really one of the key components of parent skills transfer training, because when they go out to continue the great work that you did once you're not there, being able to say to the teacher or the coach, what's helpful for Johnny is role playing. What's helpful for Johnny is positive reinforcement. And what I use is that he can get whatever reward he can get after 10 minutes of being able to attend to practice. But being able to give the parents the correct language is really key to helping them maintain and be comfortable with the new role of expert, which is what you're working them towards. Parents are treatment programs. Again, you're working on positive child parent interactions, emotional communication skills, good boundaries, good barriers, consistency, practice. And that is the practice piece is one of the biggest components in terms of effectiveness for parents. That's why there's the importance of the skills generalization and the work in the home, being able to do that in person, being able to have BHT support as well as BC support to be able to reinforce the appropriate and correct practice skills in the moment. That is hard to do over video. Parent involvement has positive outcomes with reducing ADHD symptoms, behavioral problems, improving parent skills, level of competence, and quality of relationship with parents and children. You may want to consider, and I don't know how many of you do this when you go into work with parents, but are you taking the time to do an assessment of where the parent is in terms of their stress level when you start working with kids? There's a lot of assessments that you guys do when you start working with kids, but I'm wondering how many of you use a parent assessment to see, okay, where is this parent in terms of how they're feeling about their own parenting skills, their relationship with the child. Something that I've used is the Parenting Stress Index. I found that very helpful. And I've used it, Ariel, you use the PSI, wonderful. I have found it's been very helpful because while I'm tracking a child's progress, I'm also tracking parent stress. And generally, what I find, if things are going well, that they're both going in the right direction simultaneously. Sharon also uses PSI. That's wonderful to hear. So It's great to hear that that is being used. Chasey? All right, so let's talk about parental involvement. So pros and cons of in-person versus virtual. I know this is, the ever present struggle. I remember the struggle very well when I was doing parent work myself. So the pros of in-person parent training, you get personalized interaction. It is really allows you to be more tailored in your guidance and your immediate feedback, because you're not just seeing the person on the screen, but you also are exposed to what may or may not be going on in the environment. And it can be particularly helpful because you can shift and change and target behavior in the moment. It's also really effective at stronger social connections. So rapport building. We are social creatures as humans. And that comes into play with physically being in the same space as people. It has a positive impact on neurochemicals in a way that being on video does not. Neurochemical connection with others is what helps us to develop relationships, rapport, trust, motivation, and engagement. You're not going to get that virtually. It just doesn't happen that way. And again, we're talking about hands-on training. Again, you can help in the moment, and you can also see the factors that are influencing what's going on. What other pros have you seen and experienced with in-person parent training? I know there's more than 3. What do you guys think? What have you experienced? One of the other things that I've experienced when I do when I've done in-person work, is I can see that the work that I'm doing with the parent on a particular client is impacting the other kids in the house, which I'm not necessarily going to see over video. So I can see that the parents are generalizing it to the other kids in the house, and also, to some extent with their parenting partner. Walking parents through strategy, absolutely. Chasey? Looking for
Yeah.
consistency, absolutely.
So I just wanted to add as well, we did have a question in the chat about accessing the PSI. How does one access that?
Well, you can look it up and you can order it. I can't remember off the top of my head because it's been a while if it is free or not. For those of you who do use it, Sharon and Ariel, can you share whether or not there's a cost related to it? I haven't used it in a while, so I can't remember. So you can get it through psychological assessment resources. Thank you, Amanda.
Thank you.
So the cons of in-person parent training, you have limited accessibility. Parents are not always available. They are super busy. In-person training may be geographically restricted. So for some of you who are working more in rural settings, a family may be like an hour or more away. So that's difficult. Time constraints for you as well as the family. Regular sessions can be difficult because parents, especially if they have work responsibilities, other kids, the potential for stigma. So this person coming to your home, this mental health provider, although there's been great movement in reducing stigma in terms of mental health, it's still there. Realistically, it is. In the interest of time, Chasey, we're just going to go to the next slide. And then pros and cons of virtual training. So virtual parent training, there are pros, and I'm going to give you that. It is convenient. I could not have seen all of you today for an in-person training. I know that's impossible. State of Pennsylvania is huge, and me going to be in one physical space, I'm not even sure I would even get half of you. So it is flexible, it is convenient. Online training allows parents to participate from anywhere at their own, and it can fit into a busy schedule much better. Online platforms, again, you can get the parents. They can also bring in other people, like maybe grandparents or other caregivers virtually if they're not able to visit. You can also have a meeting with school staff at the same time. It is a potential cost savings. So you're not traveling, parents not traveling. Casey? And then some of the cons regarding parent training. So there is a dependence on technology. So if your technology isn't going well, or their technology isn't going well or reliable, then you're going to miss out on sessions. You're going to miss out on providing information. There is a potential for distraction. So when somebody is with you in person, there's a level of engagement and focus that is not there through virtual means. So they can easily be distracted. And again, as I talked about, there's the reduced personal connection, just on a social level as well as a neurochemical level. And a lack of face-to-face intervention makes it harder to develop rapport, trust, and engagement. All right, next slide. All right, I wanted to mention, because I felt compelled, is where are we in terms of AI and therapy? Like there's been tons and tons of AI discussions in lots of different fields. And I just felt compelled to talk about this as the last piece in terms of the value you have in terms of your professional training and the value you bring to the work and to the outcomes. I really thought it was important to be able to wrap this up by reinforcing this. So unfortunately, we're not going to have any time for group discussion and thoughts, but the American Psychiatric Association, along with lots of other therapeutic organizations, have been studying human therapists versus, specifically with CBT versus AI driven or chat GBT. And what you're seeing, what I'm seeing all over the place is, AI is taking over this industry and this industry and this industry. And I don't know about you guys, but I'm sometimes a little nervous when I hear that stuff. But this information helped me feel better about that. We're not going to get replaced. So next slide, Chasey. So the results of the study, the findings were that the subjects or the clients gauged the quality of CBT elements specifically for CBT used in identical clinical scenarios between a human therapist as well as an AI therapist. And go back, Chasey. And the results were that the AI therapists were not viewed positively. They were viewed as more rigid, they were more impersonal, and this is whether or not it was virtual or in person. The findings found that the AI therapy lacked the nuanced empathy, therapeutic alliance that really characterizes human therapy. So as we all know, rapport between therapist and client is really one of the most effective, lack of a better phrase, kind of curative or change factors in the relationship. Computer cannot change that, which I don't know about you guys, but makes me feel better. And then the other study that I had come across post putting this training together was that they looked at chat GBT versus what a human therapist would be able to provide. And they actually found in some instances, the AI therapy was harmful. It wasn't neutral, it wasn't less, it was actually harmful. So in some instances, they were finding that AI was actually promoting harmful behaviors. So for instance, a individual who's struggling with a substance use problem, substance use challenge, was asking their therapist, what are some techniques to relax so that I'm not relying on substances? They also asked the same question of AI. And the human therapist went through the appropriate interventions. And what AI did, based on the information that AI gathered from the individual, was AI actually recommended that the person use the substances more because the substances made the person feel better, which is actually the complete opposite of what substance abuse treatment is supposed to be doing. So I also wanted to include this because when you're working with teenagers, they're so used to relying on technology, they're asking it everything, including mental health questions. So one of the things when I work with teens and young adults is, are you asking AI, are you going on Google and asking, for help for your, sadness or your confusion or your anxiety or your or substance abuse problem? And some of the kids that I work with say, yeah. And I wanted you guys to be aware, it's something that might be helpful to ask. I ask it in my practice because the AI information that they're getting can potentially, at best, be neutral, at worst, can potentially be harmful. So I am 2 minutes over. I am very sorry for that, because I want to be respectful of your time. Does anybody have any questions before we wrap up? Okay, so I will have Chasey do her exit message, and you guys have my email. So if anybody wants to reach out to me about this training, previous training, or anything, please feel free. Chasey, I'm gonna punt it over to you.
Yes, thank you. And thank you so much for a wonderful presentation. I apologize for the abrupt slide change at the end. Apparently, the wheel on my mouse decided to work last minute and it wasn't working the whole training. So it changed the slides pretty abruptly, but thank you so much. I just did want to give a quick call out. There were a few phone numbers who joined this training today, which is excellent. Thank you so much for joining. But if you could please email me your name, that way I can ensure that you receive all credit unless you may have joined another way. With the phone numbers, I can't see your personal information. So if you can just send me an email saying that you attended, and share your phone number with me as well. Otherwise, we will get a post-training follow-up email this afternoon with the slide deck as well as CEU information. And if you have any questions, please reach out to me. Thank you again, Dr. Torres O'Connor, for a wonderful presentation. And if you have any questions, please don't hesitate to reach out to either one of us. So thank you very much.